Good morning, Mr. Blastings. My name is Vakoya Green. I'm a student pharmacist here, and I'm just here to talk to you a little bit more about your diagnosis. Do you have any questions before we get started?
No, ma'am.
Okay, so you are being diagnosed with type 2 diabetes, which is another name for it would be hyperglycemia, which means that you have too much blood sugar or high levels of glucose in your blood. So the reason that this is an issue is because hyperglycemia also leads to issues with your heart. It leads to issues with your eyes, your kidneys, and all these other things that can, it's what we call a metabolic disease. So it affects multiple different things within your body. So we want to try and get that under control first so that we won't have to deal with, or that we can, limit the amount or problems that we may have in the future from other disease states, okay? So we noticed today after we ran your labs that your blood pressure was 196/96 and your heart rate was 114. Now, are you currently taking anything for your hypertension?
Yes, ma'am.
Okay, so we need to discuss maybe possibly modifying those medications to find something that would suit you a lot better. Because so far with looking at these numbers, the medications that we have you on are not working as well as we need them to. So one of the things I might want to suggest, or that I want to suggest to you, is a change in life. Can you tell me a little bit about your diet or what you eat on a day-to-day basis?
Well, I eat a lot of fried food.
Okay. So let's start with that. You also are overweight. You're considered obese based off your BMI. So while we're talking about hypertension and diabetes and things of that nature, we can start with obesity because a lot of it does stem from being overweight and not eating healthy and things of that nature. So one of the first things I want to recommend to you is something like the DASH diet. Have you heard of that before?
No, ma'am.
Okay, so the DASH diet or a Mediterranean style diet would be something that you might want to think about partaking in. A Mediterranean diet is more so consisting of beans and greens and olive oil, things of that nature, very, very light foods and nuts, versus fried foods, which we're trying to steer you away from. And then the DASH diet is a lower sodium diet so that you won't take as much sodium. So again, steering you in the right direction of a healthier lifestyle. Okay. So by modifying your lifestyle and not just saying a diet per se, because we don't want to use the term diet because that kind of puts into your head that this is going to end at some point. When you say a lifestyle change, that means that you're going to change something in your life, and that's going to be more of a permanent solution. And you're making daily changes. It's not necessarily something so drastic. So you don't have to cut everything out of your life. You can just kind of say, okay, instead of having a burger today, I'm gonna have some grilled chicken strips. And maybe if I want a burger on Friday, I'll pre-plan for that burger on Friday versus having a burger today and the burger on Friday. You see what I'm saying?
Yes, ma'am.
So that is something we want to think about as far as tackling your obesity. So I'm gonna bring you back to the hypertension. We could possibly change your regimen. So I'm thinking of taking you off of the lisinopril and switching you to Zesteretic, because I also heard, I was told by the doctor who spoke with you previously that you're having an issue with medication adherence because you feel like you take too many pills every day.
Yes, ma'am.
So we can try and modify that. So Zesteretic, which is pretty much, it's a combination medication. So you'll be able to take lisinopril and a diuretic, which a diuretic is gonna help lower your blood pressure even more, but it's a combo pill. So instead of taking two different medications, you're gonna take one and get the same benefit of both.
Okay.
So I'm thinking of switching you to that, and then taking you off of the amlodipine, and then give you diltiazem instead, which they're both calcium channel blockers, but they both work differently. So since your heart rate was 114 beats per minute, which is significantly high, we want to bring that back down. So diltiazem is going to work directly on your heart to help bring your heart rate down to where it needs to be, versus amlodipine has a different mechanism of action, so it doesn't work directly on your heart. Although they're in the same class, they work differently. So I'm going to switch you to something different that's going to bring your heart rate right on down. So also, you're also being diagnosed with hyperlipidemia, which is pretty much, it's a lot of lipids. So that comes from, you hear a lot of people say high cholesterol, that's what hyperlipidemia is. So we're trying to bring that down as well. So generally we'll institute something what we call a statin. So we're gonna take you off the gemfibrozil, which is what they consider a fibrate. We don't really normally start people on fibrates. So I'm gonna take you back to something different, and we're gonna try you on that to see how your body works with that. Now, because you also have obesity and you also have hypertension, your regimen is going to be a little bit different. So you're not going to start the way most people would, but I also want to give you the chance to start something that won't give you as many side effects, but it'll still give you the same benefits, okay?
Okay.
So we're thinking of adding Zetia, which is another type of medication, instead of Gemfibrozil, because it's proven to be more efficacious with those who have diabetes. Now, although in the same class, again, they work differently. Okay, so we're gonna try that and see how that works along with the DASH diet and those lifestyle changes that I just spoke of previously.
Okay.
Now, so far, are you following me, or do I need to slow down, or do you have any questions so far?
No, ma'am, I understand.
Okay, great. Now, as far as your diabetes goes, your levels were high. I just want to let you know what they are, so that one of the things I recommend when people first get diagnosed is that they keep a journal. So I'm telling you now, your levels today, your A1C was 10.4%, and we like to see it around less than 6.5%. So you can see it, that's a little bit high.
Okay.
And your glucose level was 544, again, very high. So with you just now being diagnosed, I just want to tell you a little bit about the disease and how we can try and modify that by the lifestyle changes that I just talked about, getting your hypertension under control. All of that is going to help bring down, that will help your diabetes, can help control your diabetes.
Okay.
Help you figure out how to live with it, and eat the right things and take your medication. So one of the first things that I want to say, that I want to discuss is you talked about having feet issues, and that in your foot sometimes you have like pain, neuropathy in your foot.
Yes.
That stems from the diabetes. So that's what we tend to call diabetic foot neuropathy. So when your diabetes is uncontrolled, like I said, it affects your nerves and things of that nature. When it's uncontrolled, your nerves start to kind of like give you like a tingling sensation. So, and the feet is like one of the biggest problems when it comes to diabetes. So we really want to make sure we get that under control before anything gets worse.
Okay.
So again, with the foot issues, we can give you something called Lyrica that is really good with nerve pain. So if you're having issues with that constantly, I have no problem with prescribing or having someone prescribe that for you to help you get that under control, okay?
Okay.
In addition to that, I also want to take you off of the Invokana that they previously had you on, because you were having issues with UTIs and just the genital mycotic infections, and they were very uncomfortable for you. So we're going to switch you from Invokana and switch you to something different, because that particular class of medications is known for having that issue. So maybe we can start you on metformin and then switch you to something different along the line, because we want to take you off Invokana altogether, okay?
Okay.
And now to your substance abuse. So we have noticed that you have some issues with alcohol as well as marijuana use. So we want to maybe talk about, are you interested in maybe a rehab facility or something like that?
Yes, ma'am.
Okay, so we can definitely get you some help when it comes to the substance abuse, especially if you're willing and you want the help. I have no problem reaching out to others to figure out where we can get you the help that you need, so you can make sure that you are living the healthiest life possible. And as I stated before, we're going to try and help make it easier for you to take your medication so that you don't have as many to take. So we're going to do that by trying to minimize the amount of medication that you take on a daily basis. And the last thing I want to discuss with you is your depression and bipolar disorder. Since that's something that you're dealing with, I wanted to institute sertraline, which is a great starter medication when you're going through mood issues. And that will be something that can help you. So I know you were saying you were struggling with your mood and you want to be there for your daughter. So this should be something that should help mitigate that problem for you. You have any questions before we go today?
No, ma'am.
Okay, well, it was great meeting with you. I hope that you're very informed and that you understood everything that I said. And I really hope that you institute those healthy modifications that we discussed today.
Thank you very much.
No problem.